Hello, I'm Dr. George Woodman. I'm a general and bariatric surgeon, and one of the things that I specialize in is hernia surgery. Now, hernias are very common and they can happen in anyone. So I just want to say a few words about the different types of hernias and the types of treatments that are available for straightforward hernias. Now, if anyone suspects that they may have a hernia, you should see your primary care physician or a surgeon, and we can give you some specialized information based on your particular situation. But in general, hernias are very common. They can occur in anyone. And the most common hernia types are inguinal, umbilical, and incisional hernias. There are several others that can occur that I'm sure you've heard of, like hiatal hernias. The most common hernia in males and females are inguinal hernias, and those are hernias that occur in the groin. They generally occur as a painless bulge in the groin. Sometimes they can be uncomfortable and rarely painful. Of course, if they're ever painful and you're suspicious that you have a hernia, you should go immediately to the emergency room or call your primary care physician. Now, inguinal hernias and all the other types of hernias generally occur when there's weakening or rupture of the tissue that holds in your organs. And what a hernia simply is the bulging out of an organ that's not supposed to be bulging out. And typically that occurs congenitally, or it can occur over a period of time when your musculature or your tissues have weakened due to chronic use or even from an incision from previous surgery. The treatment for most simple hernias is laparoscopic surgery. Most hernias, inguinal, incisional, and umbilical hernias, can be dealt with laparoscopically through small incisions, and most can be dealt with as an outpatient. There's no physical restrictions after having most hernia surgery. Oftentimes patients get the advice, well, just don't do anything about it, leave it alone until it causes a problem. We certainly do not recommend ignoring a hernia. You should at least have it followed by a surgeon where we can give you a definite plan of action. Hernias will never get better on their own. They're never going to go away, and most of them just grow over time. Waiting for them to develop symptoms is certainly not a proper plan of action. So oftentimes the most common question is, how long might I be out from work? How long will it take me to get back to regular physical activity? And the fact is you can go back right away. Now, I'm talking specifically about straightforward hernias. Of course, there are people that have recurrent hernias, people that have more complicated hernias, and those can require an open operation or a hospital stay. So those are things that we can only decide once you've visited us and we do a physical exam and take your history. But hernias are very common and they're generally straightforward to deal with, and we certainly recommend that you have them evaluated and or repaired by an experienced laparoscopic surgeon. So if you have any further questions for us, please call us at 901-869-2000, or you can visit our website, which is clubnewyou.com. That's clubnewyou.com.